Hello everyone, I am Nuha. I want to talk about Fidaxomicin antibiotic. Fidaxomicin is derived from bacteria Dictylosporinium orinticum. It's treatment of C. difficile infection. It is a first microcyclic lactone antibiotic effective against Clostridium difficile. It acts by inhibiting RNA polymerase, therapy blocking transcription and exhibited bactericidal activity. Fidaxomicin is non-absorbed macrocyclic compound. It is first antimicrobial agent approved by the FDA in over 25 years for treatment of C. difficile infection in adults. Fidaxomicin exhibited only moderate inhibitory active against gram-positive bacteria and show minimal inhibition of the normal colonic flora, including anaerobes and enteric gram-negative bacilli. This chemical structure for antibiotic. Clostridium difficile. It is a gram-positive spore-forming anaerobic bacilli which is widely distributed in the intestinal tract of the human and animal and environment. The frequency and severity of C. difficile infection has been increasing worldwide to become one of the most common hospital-acquired infections. Transmission of the pathogen occurs by fecal oral route, and most important risk factors include antibiotic therapy, old age, and hospital or nursing home stay. The clinical picture is diverse and range from asymptomatic carrier state through various degrees of diarrhea to the most severe life-threatening colitis resulting with death. Diagnosis is based on direct detection of C. difficile toxins in feces, most commonly with the use of EIA assay, but no single test is suitable as stand-alone test confirming CDI. This cycle of C. difficile infection and recurrence. Mechanism of action. Fidaxomicin inhibits RNA polymerase by means of binding to residue in zinc binding domain of the RNA polymerase. Fidaxomicin acts an early step, the transcription initiation pathway. Mechanism of resistance. Resistance to fidaxomicin is rare. However, a mutation in the beta subunit of RNA polymerase has been identified in vitro and in clinical case of recurrent infection, leading to reduced susceptibility. Antimicrobial spectrum. This antibiotic inhibits narrow spectrum activity, primary targeting gram-positive anaerobic and aerobic organism, especially Clostridium difficile. It has no effect on gram-negative bacteria. It is limited impact on the normal gut microbial, contribute to the lower recurrence rate and reduce spore formation compared to vancomycin. North American clinical trial finding on the fidaxomicin. It is significantly reduced recurrence rate compared to vancomycin, especially in patients infected with non-PI NAB1 27 strain. PI NAB1 27, it is more resistant strain of C. difficile. This slide, it is distribution assay showed a clear inhibition zone with fidaxomicin against C. difficile anaerobic pathogen collection, confirming its strong antimicrobial activity. Efficacy conversion with vancomycin. Fidaxomicin 200 mg orally twice daily and non-inferior to vancomycin 125 mg orally 4 times daily for the treatment of C. difficile infection, based on a clinical response after 10 days of treatment, superior to vancomycin in maintaining a sustained response without recurrence 25 days after treatment completion. Limited systemic effectiveness. Fidaxomicin has minimal systemic absorption, not effective for treatment of systemic infection, act locally in the gastrointestinal tract. Warning and application: use only in confirmed or strongly suspected cases of C. difficile infection. Avoid inappropriate use to reduce the risk of antibiotic resistance. Should not be used empirically for infection outside the GIT. Conclusion: Fidaxomicin has proven effective and safe for CDI treatment, showing similar cure rates to vancomycin but with significantly lower recurrence, particularly in non-BI NAB127 strain. Its narrow spectrum and favorable side effect profile make an available options. However, due to high cost and limited data in severe cases, its broader use require careful consideration. Further studies are needed to establish its long-term role and cost-effectiveness in clinical practice. This reference used in the research. Thank you.